Everyone, and welcome to First Friday. This is the March edition, 2018. We're roughly 20 days from spring, and that's very exciting. It's sort of a slow time of year for health insurance, and I wanted to talk today about what the government calls lock-in. Basically, what lock-in means is that you're locked in to whatever health insurance coverage you had beginning of the new year after open enrollment ended, whether it was for the individual market for yourself and your family or whether it's for Medicare products. So being March the 2nd, we are in lock-in. So you're locked in to what you currently have. Now, I get questions. I've had two in the last week and a half from folks asking me about changing their drug plan, changing their Medicare Advantage plan, that sort of question. Unfortunately, there's not a lot you can do during lock-in because you are locked in to those products. And since the government now controls when you can enroll, they also control what you can do after that enrollment period ends. And so for Medicare particularly, during open enrollment at the end of the year, you can make any necessary changes that you want. However, after open enrollment ends, then you're not able to make any changes, except that they do have an annual disenrollment period, which runs until February the 14th. But that is just if you're on a Medicare Advantage program, and you can drop that program and you can go back to original Medicare, and they do allow you to pick up a drug plan at that time. But we're now past even that annual disenrollment period. So we're truly in lock-in. Now, as far as Medicare is concerned, one of the things that you can purchase during the year is still Medicare supplements. Because Medicare supplements, unlike Medicare Advantage or Medicare drug plans, Medicare supplements are regulated by the federal government, but they're not controlled by the federal government. So there's certain things, standardization and things that have to be included with Medicare supplements that the government regulates. But as far as when you can enroll and when you can't and that sort of thing, it is pretty much you can do that anytime. However, there are some caveats to that because Medicare supplements you do have to qualify for based on your health conditions. So during your guaranteed issue period or when you're new to Medicare, those health conditions are waived. There's no questions, there's no underwriting, and you're able to get a Medicare supplement. So that's why it's so important when you're new to Medicare that if you feel like you need a Medicare supplement, or if that's something that your agent, like myself, would advise you to participate in, then you want to do that during your guaranteed issue period so you cannot be denied based on a health condition. But outside of that guaranteed issue period, to get into a Medicare supplement plan, you have to be able to pass all the underwriting questions. And then if we're in this lock-in period, you also have the question of your drug plan, which you cannot get during lock-in because we don't have a valid open enrollment period. Now, if you move into a new service area, and this would apply to health insurance for under 65 as well as over 65. If you have a qualifying event such as you moved from one state to another, you've moved out of the service area for your health insurance, then you do have a valid open enrollment period, a special open enrollment period in which to enroll. And that usually only lasts for 60 days or 63 days technically. So you want to make sure that when you move or have one of these qualifying events that you take action very quickly. Also, the penalty is still in play for not having health insurance. And so those 63 days is your period when you would not be charged a penalty for not having health insurance. So I know it's very complicated, and sometimes people get very frustrated because they can't do what they want to do when they want to do it. But that is just a part of the situation as it is today. And so you have to be very aware of these enrollment periods and know what's going on. Another open enrollment period, special enrollment period, is a qualifying event if a person loses their job. So again, this could be in the individual market, the under 65 market, or it could be for Medicare as well. So maybe you lose your job and you've lost your employer health plan, then that would give you a valid enrollment period either to jump into a government-sponsored plan via healthcare.gov, or it would allow you to get into a Medicare product if you're eligible for Medicare. So that, again, your 63-day period would begin when you lose your employer-sponsored plan. So I hope that helps just a little bit to understand why we don't do a lot of marketing in March. Really, we don't do any marketing much at all from in the spring and summer, and then once we start getting into the fall, you'll start hearing advertisements, and people like me will start talking about upcoming open enrollment periods, which reminds me of a television commercial that is running all the time. And if you're on Medicare, you may have seen this and you may wonder what it's all about. There is a TV commercial that's running, and it's a man, and he has on a lab coat, and he is talking about getting on a Medicare plan, and you may qualify to get on a Medicare plan, and you may qualify to get on a Medicare plan that has a lot of extras, no premium, that sort of thing. And so what he is talking about is actually a Medicare Advantage plan. However, if you notice very carefully, it says call to see if you qualify. So the only reason you would qualify to be able to enroll in that plan in March would be because you had one of these qualifying events, or maybe you're new to Medicare. You're turning 65, or you've lost your employer plan, and you're now going to be on Medicare Part A and B. I have actually even read the small print that flashes up very quickly after that ad. And if it appears during a program that you've recorded, you can actually stop it and read the small print. And a lot of what I've just said is in the small print there. And also it does say that you're talking to an agent, and you will be they will collect your name and your contact information, and they will try to contact, they will try to contact you later if you don't qualify for an open enrollment period. So I would be very hesitant about calling anyone on TV like that. I try to advise my clients that, don't respond to anything on the internet, don't respond to anything on the television, don't respond to anything that you receive in the mail, especially if it is just a generic kind of ad. Don't send it back. Don't give them your number. Don't give them your address, because if you do, you're giving them permission to contact you, as is required by the federal government. So if you reach out to them, you've now given them permission to bug you. And so a lot of people don't want that. And so be very careful about responding to any of those kind of things. Of course, I would be glad to help you in a very legal and compliant manner during open enrollment. But a lot of times people will have questions during the year about their coverage, and I'm always happy to answer those questions. So you can give me a call, you can give me a comment below, you can email me. There's lots of ways to get in touch with me. If you have not gone to my Facebook page, Holt Health Insurance, I recommend that you do that, and you can leave me a comment there or ask me a question there. Also, if there's something that you would like for me to talk about during one of these First Fridays, leave me that kind of comment as well, or private message me even, and I'll be glad to talk about that so that everyone can learn from your question. So have a great Friday. It's a little cool here in Tennessee, but the sun is shining and all the trees are starting to bloom, and we're very excited that spring is on the way. So thank you for watching, and I will see you in April for First Friday.